going on here. So he's been cleansed. First thing we're going to do is just create a big stick, Denny. Okay, take a breath. And we're just going to put a little, this is lidocaine with a little bicarb so it doesn't burn. And as you can see, we make a little wheel right there. And then take the lidocaine and go where the pellets are going to go so he has more comfort and less pain. We don't believe in the no pain, no gain theory most of the time. And all I'm doing is just giving him a nice area with numb right underneath it. And I'm making 3 different wheels there because Danny's going to be getting about 2,000 milligrams. That's his dosing based on what his levels are for the testosterone. And this is a 3rd wheel that we're going to create. And essentially all we're doing is numbing him right now. And we like him to be as comfortable as possible. So that's what I'm doing at this point. And it's going to take a couple minutes and he'll be nice and numb. You okay, Danny?
Mm-hmm.
Good. All right. So we're going to let that do its thing. All righty. So again, you know, something that we just discussed a little bit ago is pellets as compared to injections and others. In men and women both, when you're doing bioidentical hormones, in men you need to really look at testosterone, estrogen, and progesterone. So you might ask, well, why do men need estrogen? Well, we need a balance. We need not too much estrogen because a lot of men, when you give them testosterone, they might actually convert to estrogen, so you've got to keep that in mind. How are you feeling, Danny?
Good.
Good. All right. Now we're going to see how he's doing and let me know, do you feel sharp or pressure, Danny? Do you feel anything sharp?
I don't really feel anything.
So he doesn't feel anything, which is great. So I'm going to go ahead and just make an incision. It's going to be a small incision, nothing major, and it's really tiny. So if you want to take a look, we'll zoom in to show you how small this incision is. It's quite small, and that's what we work through. So once that incision is made, then we're going to be ready to start. All right, so with that being said, the next thing we're going to do, either way, all right, is I'm going to take this here. So these are my instruments, and I'm going to show you, this is the pellets right here. So each of the bottle is 200 milligrams inside. So Glenda's now going to open those and place the pellets in that sterile tray for me. So as you can see, and she's going to give me 10 of those. So do you see how small this pellet is? This pellet is about the size of a grain of rice, and he's going to have 10 of those in 3 different planes, and that's going to be giving him what he needs for the next 4 to 6 months, depending on his own metabolism. So that's what we're doing. So now the next step is you take the trocar and you're going to introduce the trocar and essentially get it into the first plane. So I'm just getting it into the first plane right here. And the plane is, it's important which plane we're in. I need some more 4x4s, please. You're basically going to lay it on the 4x4, and I'm going to bring it in for him. And as soon as I'm where I need to be, I'm going to start placing the pellets. Okay, he's doing great. Alrighty, so when I have it where I need it, then I'm going to remove the sharp one. And Glenda's holding it for me. I'm going to lay the first one in, take the blunt, put it in there, rotate it all the way to 3 o'clock, and I'm going to place the pellet where it belongs. So that's one in. Then I rotate it up, take the trocar out, get my next one, and that's going to be placed right at 12 o'clock. So this is the second one going in, and I hear the release, and that means it's where it needs to be. I remove it. It's pretty simple. I take the third one, place it, place my trocar, I rotate it to the next plane, and release it. Rotate it up again, get my fourth one, place it, bring it on, rotate it all the way to 6 o'clock, release it, and it's released. Then I've got 4 in, and a few more to go. So we're going to get to the next plane now. So what we do is I bring it out about 1/2 centimeter and go around the last pellet that I placed to be able to get 4 more in there. The important thing is the plane that it goes in. That's very, very important. So I always remind myself of the plane by laying it on the gauze and grabbing the next one, placing it, making sure it doesn't fall. So I've got my sterile hand right underneath it, and also the tray. So I've got this. I'm going to go back to 3 o'clock and release it. And he's doing great. How are you doing, Danny?
Good.
Good. Do you feel much?
Nope.
Good. So he's ultra comfortable, and we'll be done in just a few short minutes here. So there's 3, and I've got 5 more to go. Got my next one going in at 12 o'clock, and I'm using the blunt trocar for this. So that's going in at 12. Easy. Remove it. Take the next one, and I'm going to place this one at 9 o'clock. And what I'm going to do is, in this plane, I'm going to put 3 in because I've got 3 more left, and I'm going to put the last 3 in the last plane. So that just makes it easier for him. So again, I'm going to withdraw just about 1/2 centimeter, get around the last pellet, and go into the last plane. He's doing awesome. And as you can see, I don't make the incision any larger than I have to because he will heal better, he'll have less pain, and those things are very important to any of us. So then, this is my last 3 that I'm putting in here, and I'll put this one at 3 o'clock, and there it goes. And got 2 more to go. The next one is going to go at 12 o'clock. Good. And then my last one is going into a 6 o'clock position. So here we go, all the way down, and there it is. So now when that's done, I know all 10 of them are right here. I'm going to gently remove the trocar. And as you can see, the incision, and you can take a close look, is very small. And all the pellets are right in here, 10 of them. Incision is small. He's not bleeding. He's doing great. And so you don't even need a suture for this because it's a small incision. All you need is steri strips. So this is a vertical incision. We're going to put the steri strips horizontally. And I like to just put a couple extra just because it will be good for him. And what we're going to ask him to do is hold some pressure on it in just a minute. What I also then like to do is put a little pressure. So I'll take a 4x4 and place it right there and cover it with Tegaderm. As you can see, there's no major anything going on over here. We'll give him a Tegaderm, and that's going to hold good pressure around it. I stretch it, keeps it sterile, keeps it from getting infected, and all of that is very important to me because I want him to have a good post-op course and enjoy this pellets without any complications. Voila. So this is something, and I usually will ask Danny, would you mind giving me your hand, please? So what you're gonna do, Danny, is this is where the incision is.
Yep.
Just hold a little pressure. We're gonna get you an ice pack.
Okay.
And if you have any soreness, just ice it. Otherwise, you will be A-okay. We'll be giving you some post instructions, and I'll keep you kind of covered. And we'll turn the camera that way so he can be getting dressed. So thanks, Danny, you're good. So essentially, the bottom line is, just to kind of review, for men, hormones are just as important as for women.
Yeah.
Men do go through andropause. It's a tough time for them as well because not as many of us talk about hormone replacement in men, but it's very, very important. So get yourself tested. If you feel like you don't feel like yourself, get your testosterone, estrogen, DHEA, progesterone, PSA, all your thyroid labs, your liver, kidneys. Those are like your basic labs along with vitamin D. Every man should have that done at least once a year. If your testosterone is on the low end of normal, so for example, if you're not feeling good and your testosterone is in the 300s to 600s, you may need a little bit of help with supplementation. Not complete replacement because you want your testes to still work, but you want supplementation. So that's a very, very important thing. When you do realize that you need testosterone, consider doing bioidentical testosterone. You can do that in the form of a gel, a troche, an injection, or pellets, depending on what suits you and there are pros and cons to each. So have your practitioner explain that to you. If you have any questions, you're certainly welcome to call our consultants or just go to our website and learn more and do a testosterone deficiency test if you'd like. There's a lot of test yourself stuff that you can do on the website for free and see if that's something that you need help with. So that's drshel.com, and thank you for joining us.